Good evening, friends. We have heard of persons who come to the physician or the psychiatrist with complaints of palpitations. Sir, my heart is beating. I'm suffering. I'm feeling pounding in my chest. I'm feeling as though my heart will burst now. Severe palpitations people can develop and present to the clinician. More often than not, these palpitations are non-cardiac in nature. Cardiac means heart, non-cardiac means common thing. Not that cardiac palpitations do not occur, don't be misled by my statement, but the commonest causative factor for such palpitations is non-cardiac. What do you mean by palpitations? Our conscious feeling of our heart beating, this we call as palpitations. As I said, it can be very common due to our anxiety, due to our stress, due to our tension, due to sleeplessness also. People can develop intense beatings of the heart. In medical terms, they are called as palpitations. Sometimes a severe panic attack can also result in production of palpitations. It's all due to anxiety. Some local conditions, like perhaps if a tumor is growing in the thorax, if there is an abdominal tumor, then also patients can develop palpitations. A dilated stomach that can produce palpitations. Have you not heard of this thyroid disorder called as Graves' disease? All of you, more often than not, have heard of hypothyroidism that can produce symptoms of depression. In contrast to that, here is a disease, my friends, wherein the thyroid gland indulges in an excessive production of thyroid hormone. The result, the consequence, the catastrophe is what's called as Graves' disease. The thyroid gland enlarges in size, it becomes visible, it becomes apparent to an astute clinician. Such people can have protruding eyes. It's called as exophthalmos. This disease, Graves' disease, also can produce severe palpitation. Or anemia, a severe anemia, when there is low hemoglobin in your blood, that also can produce palpitations. Previously, early stages of pulmonary tuberculosis, these patients also used to come with palpitations. Of course, other accompanying symptoms like cough, etc., used to be there, but these patients also have had palpitations as one of their cardinal features. These are the common conditions. Cardiac conditions, I am not dwelling into it. There is a host of disorders which can produce palpitations related to the heart or related to the heart. For example, we call it as SVT, supraventricular tachycardia. The heart rate can go up to 200, 250. In such conditions also, persons can exhibit severe palpitation, severe discomfort in the chest. Another non-cardiac condition producing palpitations is what is called as DeCosta's syndrome, neurocirculatory asthenia. It is also called as cardiac neurosis. Such conditions are more common during times of war. Not that it can't occur in civil life, it can occur also, but such syndromes used to be seen during catastrophes like times of war, etc. You may ask me, Dr. Saab, Can I get palpitations if I drink any liquid? Yes, any beverage like consumption of tea, coffee, or an excessive intake of alcohol, tobacco. They all can produce palpitations. Don't you worry at all. There is a relief for palpitations. A good clinician can make a diagnostic formulation and distinguish your cause of palpitations. Is it due to a psychiatric disorder or is it due to a non-psychiatric disorder? Never ever suffer within yourselves. Don't make any diagnosis by looking at Google diagnostic formulations. Consult your doctor and get an immediate relief. Thanks a lot. All the best. God bless you. If you like the video, please share it. Bye bye.